My name is Isabella. Welcome to Eyes and Vision. I'm here at our Unley Clinic today, and I'm just going to take a few minutes today to talk you through what our general assessment looks like. What do we actually do in the consult room? So every appointment is going to look a little bit different. We really cater our appointments to really specific patient needs, but they all kind of follow this similar blueprint. So if you're coming in to see us for the first time or just for a general checkup, it'll probably go something like this. Now, I know that the idea of an eye test can look a little bit scary to some people, it's a bit intimidating, but I'm going to talk you through what we do here, and hopefully you'll feel a lot more familiar with how we go about things and feel a lot more comfortable when you come in for your assessment. So some things that you'll see here today are going to look really familiar to any optometrist. There's a few things that are a little bit different, but I'll talk you through them. All of our appointments go for about 30 minutes. I'll always take the time at the beginning of an appointment to check why you've come in today, maybe discuss what aspects of your vision are causing more trouble. We'll have a really nice chat about work, lifestyle, hobbies, work out what your personal visual needs are and where some corrective lenses might be of help to you. We also have a chat about your ocular health, your background, your general health. All of these things can have an impact on your vision, and if we really tailor that approach to you, we can give you the best vision care possible. Alrighty, so this one here is our phoropter. It's filled with all different kinds of lenses that help us work out what your prescription is, or essentially the strength of glasses that you need for your best seeing vision. So for some people, the glasses that they need to see clearly in the distance or for driving is quite different to what they need for the computer or for reading a phone. So if you sit in front of your computer 9 AM to 5:30 PM, if your monitor is your life, you'll be jumping in front of my screen and we'll be working out a good computer prescription for you. Then we think, are you into sewing? Are you a mechanic? Do you have really specific visual needs for really close distances? If you do, this is our opportunity to simulate those and find out the best pair of glasses that can work for you. And it's only fair to warn you, I will be making you wear the silly frames just for a couple of minutes, just so you can see how that prescription feels, make sure it's nice and comfortable for you, and you're all good to go. Perfect. So this is when we start to shift our focus a little bit. If you think of your eye exam as one big jigsaw, the glasses are just one piece of the puzzle. So here at Eyes and Vision, not only do we care about how well you can see and making sure that you have the glasses to achieve that vision, we also want to make sure those eyes are healthy and actually safeguard that vision so that you're seeing well for years to come. So we have a look at the front of the eye, we have a look at the back of the eye. There are so many complex structures there, and we want to make sure that every one of them is doing their job properly. So this here is our slit lamp. It has all sorts of illumination and magnification techniques to help us get really nice views of the front of your eye. So if we're looking at things like cataract, we'll see this here. If you struggle with dry eye, maybe some itching or some allergy, particularly throughout hay fever season, we'll spend a little bit more time on this one here. Also want to have a look at the pressures in your eye. So we use this machine right here. Pressures give us a really nice indicator of the general health of your eye, but also helps us establish your risk for developing glaucoma later in life. So now I want to see how the back of your eye is looking. So there's so many different ocular conditions that affect the back of your eye without you actually noticing any changes in your vision at all. So what makes us different is not only do we look at the back of your eye, we document it and we monitor it. And we're able to do this with our imaging techniques, and that is our standard of care here. Now this one here is our laser scanning device, or our SLO for short. So within seconds, this machine can take high quality, full colour images of the back of your retina, spanning 80 degrees across that retina, which is the inner lining of your eye. We get to visualise really important structures, such as your optic nerve, which is the part that connects all the way back to your brain. And we also get to have a look at your macula, which is the little pit of photoreceptors where all of your best central, fine detailed vision comes from. So this is an image taken from one of our diabetic exams to compare for you. Now, diabetes can affect the super delicate blood vessels at the back of the eye, causing leakage of blood and fluid and lipid. So not only is our machine able to detect these changes kind of around here and here and here, it's also be able to track them and monitor them for when this patient returns. we'll be able to see if their condition is getting better or getting worse, how quickly it's worsening, and whether some intervention is needed.
This next machine here is our OCT. It uses reflected light beams to produce images of the back of your eye that cut through even further than our SLO. So here we can get super detailed scans of your optic nerves, which is absolutely crucial for diagnosing and monitoring glaucoma. And we also get beautiful cross-sectional images of the macula that we mentioned earlier. The OCT helps us to detect so many things that won't actually appear on any other test.
Watching this video so far thinking my eyes are super healthy, I don't need the photos or fancy imaging, but I cannot stress to you enough the value of having beautiful scans when your eyes are healthy. It just helps us so much more in the long term when we're looking at diseases later on. If we have something to compare to and some baseline data to compare to, we can find changes so much quicker. So any disease-related changes become so much faster to detect, leading to more efficient treatment for you, earlier intervention, and really just better visual outcomes for you. That just about rounds out your eye assessment. If all is well, we'll see you in 12 months. Sometimes we might find something that we want to keep a closer eye on, so we'll bring you in a little bit sooner for monitoring. Everyone's scheduled imaging looks different, so when we want to see you, it's going to look quite different to another patient. Please do not hesitate to contact us if you'd like to book an appointment. Feel free to visit our website. You'll find an online portal where you can arrange an appointment time. Otherwise, you can just click the QR code on the screen and it will take you straight there. Other than that, we've also got all of our clinics available. Feel free to walk in, give them a call, and we can arrange an appointment there. So we look forward to seeing you soon.